Did you know that less than 1% of people over 60 practice isometric exercises, even though this type of training can slow muscle aging, reduce joint pain, increase bone density, and restore strength faster than almost any other form of movement? The amazing part is, you don't need to run, lift weights, or even move. All you have to do is hold one position correctly and let your body reactivate its inner strength. It sounds simple, but the results are so powerful that many of my patients tell me they feel 10 years younger after just a few weeks. And before we dive into the 6 most effective isometric exercises, I want to know one thing. Right finger, how old are you? Leave a number 1 in the comments if you're ready to begin your strength restoration journey today. If you want an exercise that is simple, powerful, and perfect for anyone over 60, the wall sit is the number 1 choice. Don't let its appearance, just sitting against a wall, fool you. Inside this position is an entire system of muscles and joints working, learning, rebuilding, and restoring strength you thought you had lost. Imagine this. You stand with your back against the wall, slowly slide down until your knees reach a 90 degrees angle. And then you hold. Within seconds, your legs begin to warm up, maybe shake a little, and that's not weakness. That's awakening. Why the wall sit is so effective. When you hold this position, your quads, hamstrings, glutes, hip muscles, and deep stabilizers all activate at the same time. No movement, no impact, no joint stress, just pure strength, stability, and intelligent muscle engagement. Every second you hold the position, your muscles receive the message. Get strong again. Remember how to support this body. Wall sits also help increase blood flow in the legs, improve knee mobility, reduce lower back pressure, boost endurance and standing stability, lower fall risk by strengthening the thighs and glutes. For older adults, where thigh weakness is one of the main causes of difficulty climbing stairs, standing up, and walking with confidence, the wall sit is a simple but powerful medicine. How to do it safely and correctly. Stand with your entire back against the wall. Slowly slide down until your knees reach 90 degrees, or a higher angle if you're just starting. Keep your back pressed to the wall and gently engage your core. Don't let your knees move past your toes. Hold for 20 to 30 seconds, adding 5 to 10 seconds each week. Remember, shaking is not weakness. Shaking means your muscles are waking up. Real results. Many of my patients could hold only 10 seconds in the first week. But after 3 weeks, they climb stairs without pain, stand up faster, feel real strength returning to their legs, walk with much greater confidence. The wall sit requires no equipment, no big space, just a wall and your decision to show up every day. If the wall sit wakes up the strength in your legs, then the isometric glute bridge is the exercise that switches back on your body's central power system. Many people over 60 don't realize that lower back pain, uneven walking, weak steps, or poor posture often don't come from the back at all. They come from glutes that have been asleep for far too long. When the glutes are weak, the spine is forced to carry all the load. The result? Back pain, difficulty standing up, stiffness after sitting, and every step feeling weaker than it should. The isometric glute bridge restores that balance. Why the isometric glute bridge is so important? When you lift your hips and hold the position, 3 major systems activate at the same time. 1. Gluteus maximus, the main power muscle. Right pointing arrow responsible for lifting the hips and generating force when you walk or climb stairs. 2. Lower back muscles, erector spinae. Right pointing arrow supported instead of overloaded. 3. Deep core muscles. Right pointing arrow stabilize your entire trunk and improve posture. No intense movement, no heavy pressure on the joints, Just holding the position allows the body to repair itself and reactivate strength that has faded over time. Research shows that holding a glute bridge for 20 to 30 seconds can reduce lower back pain, improve pelvic stability, increase blood flow to the lumbar area, support better posture, make standing up and sitting down easier. How to do it correctly. Lie on your back with your knees bent and feet hip-width apart. Press your heels into the floor and slowly lift your hips. Form a straight line from shoulders right pointing arrow, hips right pointing arrow, knees. Squeeze your glutes as if holding a sheet of paper between them. Hold for 20 to 30 seconds, breathing steadily. Lower slowly, rest, and repeat. And remember, don't lift too high. This exercise is about stability, not height. What you'll feel. After just 1 to 2 weeks, many of my patients tell me, standing up becomes easier. No more morning back pain. Their walking feels steadier and more supported. Lower belly feels firmer, hips more flexible. One 72-year-old patient told me, "Doctor, I can't remember the last time I stood up without back pain. Now I finally can." The isometric glute bridge is a small exercise with big impact, especially for anyone wanting to restore back stability and hip strength. If the glute bridge helps you build a foundation, then the isometric warrior pose is the exercise that builds your full body framework. This isn't just a beautiful posture, it's a deeply restorative isometric movement that makes the body both strong and stable. It's especially valuable for anyone over 60 who has begun feeling their balance decline, worries about walking faster, or fears slipping. The pose is called warrior because it activates your entire neuromuscular system in a way that makes you stand firm like a fighter, even though the outside looks calm and gentle. Why the warrior pose is so powerful. When you step one foot forward, extend the back leg, and hold the position, your body immediately recruits multiple muscle groups. Quads and hamstrings right pointing arrow support weight and stabilize. Glutes right pointing arrow maintain balance and support the hips. Deep core right pointing arrow prevents rotation and keeps the torso upright. Back and shoulders right pointing arrow open the chest and improve posture. Neuromuscular system right pointing arrow sharpens balance reflexes. There's no fast movement, no impact, but every second you hold the pose is a test of stability, control, and true body strength. Many of my patients describe the feeling after just a few minutes. "I'm not just stronger, I feel steady again." How to do it safely and correctly. Stand tall and take a long step forward. Bend the front knee slightly. Keep the back leg straight with the heel pressed into the ground. Extend your arms to the sides or raise them overhead. Keep your chest open, core lightly engaged, and spine straight. Breathe deeply and hold for 20 to 30 seconds on each side. If you're a beginner, place your hands on the back of a chair for support. The benefits after just a few weeks. Noticeably better balance. Stronger, more confident steps on slippery or uneven surfaces. More flexible hips and less morning stiffness. Straighter posture with open shoulders and a lifted chest. A calmer mind. Many people say they feel steady, both physically and mentally. One 70-year-old patient who used to fear going outdoors because of poor balance told me after 4 weeks, "I walked in the park without holding on to anyone. I haven't felt this confident in years." The warrior pose doesn't just strengthen your body. It helps you reclaim your sense of control, courage, and stability in every step, something age should never take away. Among the 6 isometric exercises, the isometric plank is what I call the body's shield, because no other movement activates the deep core system as strongly and completely as the plank does. Especially after age 60, when the deep abdominal muscles and lower back stabilizers weaken faster than most people realize. The plank becomes the exercise that prevents back pain, keeps your posture upright, and stabilizes every movement you make. And the best part? You don't have to move at all. Just hold the correct position, and your body will rebuild strength from the inside out. Why the plank is absolutely essential after 60. When you enter the plank position, a powerful chain of deep muscles activates. Transverse abdominis, deep core, your natural belt that protects the spine. Erector spinae, the muscles that keep your spine tall and aligned. Glutes and hip muscles, stabilizing the pelvis. Shoulders and upper back, supporting the upper body and improving posture. This is your body's central support system. When it weakens, you begin to feel lower back pain, rounding of the shoulders, loss of balance, slower transitions when standing up, a sense that your body feels loose or unstable when walking. The plank addresses all of these in just 15 to 45 seconds a day. How to do it correctly. Place your elbows on the floor, directly under your shoulders. Extend your legs behind you, toes on the ground. Keep your body in a straight line from head to heels. Gently engage your core. Don't let your lower back sag. Hold 15 to 20 seconds to start. Then gradually increase to 30 to 45 seconds. A crucial tip. Right finger, don't hold your breath. Inhale deeply. Exhale slowly to control the muscle tension. If the traditional plank is too hard, lower your knees to the floor. You'll still get 70 to 80% of the benefit, with excellent safety. What you'll notice in a few weeks. Many older patients tell me that after just 2 weeks of consistent planking, they feel a naturally straighter posture, much less morning back pain, faster walking without fatigue, more confidence on stairs, a firmer core and more flexible hips. Some even say, "Doctor, it feels like my whole body has tightened and stabilized again." That's the sign your core has awakened. The plank isn't a bodybuilding exercise. It's a recovery exercise, one that helps you regain control over your body. A control that time often fades. With just a few seconds each day, you're rebuilding a strong, protective shield for your spine that lasts all day long. If the plank builds the shield that protects your spine, then the dead hang is the exercise that frees your spine from the pressure it has carried for decades. It's one of the simplest movements, yet it creates some of the deepest transformations in people over 60, especially those who struggle with back pain, stiff shoulders, or that heavy, compressed feeling from years of sitting. The dead hang doesn't require you to pull up, lift your body, or use force. You simply let go. And in that relaxed state, your body begins a powerful recovery process. Why the dead hang is shockingly effective. When you hang from a bar, or a sturdy doorway, several important things happen. Spinal decompression. The vertebrae gently separate, reducing pressure on the discs. Natural stretch for the back, shoulders, and arms. Increases blood flow and releases stiffness. Shoulder joint opening and lubrication. Reduces pain when lifting or rotating the arms. Nervous system, reset. Creates a feeling of lightness, relaxation, and reduced stress. For older adults who have spent years lifting, sitting long hours, or carrying heavy loads, the dead hang feels like giving their back and shoulders a chance to breathe after decades of overwork. How to do it safely after age 60. Choose a sturdy bar or a thick doorway frame. Grip the bar at shoulder width. Lower your body slowly. If it feels too heavy, keep your toes lightly touching the ground to reduce the load. Relax your shoulders, back, and neck. Hold for 10 to 20 seconds if you're just starting. Repeat 2 to 3 times. Important. Right finger, don't shrug your shoulders. Right finger, don't lift your head. Right finger, don't hold your breath. The goal is relaxation, not lifting your body. The results you'll feel after a few weeks. Many of my patients, especially those with shoulder pain, back tightness, or mild disc issues, feel remarkable improvements. Lighter back when waking up. Shoulders move freely without pain. Reduced numbness or heaviness in the arms. Naturally straighter posture. A sense that the whole body has opened up. One 64-year-old truck driver told me, "Doctor, just 15 seconds of hanging feels like my back has been released. My whole body feels lighter." The dead hang isn't a strength exercise. It's one of the most powerful passive decompression therapies for the spine and shoulders, helping you regain flexibility that may have been lost for years. If the dead hang frees your spine from above, then the isometric Superman is the exercise that activates and reinforces the entire posterior chain, from the neck, back, and glutes to the hamstrings and even the feet. I often call this movement the final line of defense for the lower back, because no other exercise supports the back as completely as this one. For adults over 60, the lower back and glute muscles weaken quickly, leading to a forward-leaning posture, fatigue when standing, stiffness after sitting, and a general feeling that the back is heavy and weak. The isometric Superman brings that strength back. Why the Superman pose is especially effective. When you lie on your stomach and lift both your arms and legs, your body recruits erector spinae, the muscles that keep your spine upright and prevent hunching. Gluteus maximus, the powerful hip extensor that drives your steps. Hamstrings, support standing up and stabilize the knees. Rear shoulders and upper back muscles, keep posture tall and open the chest. This exercise activates the entire posterior chain, the group of muscles responsible for supporting your whole body. When this chain weakens, you'll experience lower back pain when standing, difficulty bending forward, tiring quickly while walking, losing your natural upright posture, increased fall risk due to unstable hips and weak glutes. The isometric Superman helps reverse all of these issues. How to perform it safely after 60. Lie face down on a mat. Extend your arms straight forward and your legs straight back. Inhale. As you exhale, gently lift your arms and legs at the same time. Hold the position for 10 to 20 seconds, breathing steadily. Lower slowly and repeat 3 times. Important notes. Right finger, don't lift your head. Keep your gaze on the floor to avoid neck strain. Right finger, you don't need to lift high, stability is the goal, not height. The benefits you'll feel within a few weeks. Most older adults who practice this exercise report the same improvements. A naturally straighter back. Less pain when standing up or sitting down. Longer, more confident steps. Stronger, more flexible hips. A sense that the body supports itself better. One 67-year-old patient who had back pain for years told me, "After 2 months of doing the Superman, I stand taller and my back feels so much lighter. My grandchild even said I look younger." That is the power of this exercise, a quiet, deep rejuvenation from the inside out. When you complete these 6 isometric exercises, you're not just training your muscles, you're awakening a deeper strength inside you. A strength time once made you believe you had lost. Every second you hold a position, every breath you control, is a reminder that age does not determine your ability. Your body can still become stronger, more flexible, and more powerful. All it needs is the chance. Remember, you don't need heavy workouts, you don't need equipment, and you definitely don't need to be 20 again. You only need a few minutes each day to rebuild your stability, your confidence, and your freedom in every step you take. Stay on this journey, for your health, your independence, and your joy in living. If you're ready to stay consistent each day, leave a comment. I choose strength.